I'm Alicia, and this is I'm a student from St. Francis, and I'm going to do your assessment today after having your baby. How are you feeling today? Okay. With looking at her vitals on the machine, I'm going to do her temp, and this one I'm going to do orally. I'm going to wash my hands before I start my assessment, and I'm going to begin with vital signs. If she's not already on the monitor, then I'm gonna bring in the vital machine. But I'm gonna start with the temp, and I'm gonna do that orally. Okay, and that's normal. 97.8. And then I'm going to put the blood pressure cuff on. And the whole time I'm going to be talking to her of how the delivery went and how the baby was. Go ahead and start like emotional and education as I'm doing the assessment. I'm going to ask, if the whole time I'm doing the vitals and listening to her, if she's, feels okay of going home with baby, if she has a lot of support group. Just talking to her the whole time I'm doing her assessment. Okay, so I did her blood pressure. It's 120/80, and then I had the pulse ox on as well as I'm doing that. So her heart rate on the monitor says 82, and she's 100% standing room air. Okay, and then I'm just going to go from top to bottom, from head to toe with my assessment. And I'm going to start listening to her lung sounds. Take a deep breath in and breathe out through your nose. Okay, lung sounds are clear. And then I'm going to put gloves on just because we're going to start the assessment and opening bare skin. So I'm going to make sure the curtains close and give her privacy because we're going to check her breasts, and I'm going to let her know that and I'm going to make sure that I'm going to do your assessment on your breasts. Have you had any warm feeling, any pain, any abnormal discharge other than what is normal after delivery? And she's going to say no. So I'm going to undo her gown one at a time, one breast at a time, and then I'm just going to palpate in a circular motion, start at the nipple and go out. And I'm feeling for any lumps, any warmth, any redness, any hot discharge, anything like that. And then I'm going to go to the next breast and make sure that she's covered each time I go to the next breast. Her abdomen. And I'm going to check your abdomen again. I'm going to lift your gown up. Okay. Listen to your bowel sounds before I start playing and palpating it. I don't want to activate any of your false bowel sounds. So just breathe normal. Okay, those are active bowel sounds. And then I'm going to feel her uterus, and I'm going to put one hand to support the uterus, and then I'm going to palpate and find that fundus, that hard nodule. And then at this point, I'm going to tell her to prevent any more hemorrhage or to get more of the old blood, I guess, or to prevent bleeding to stop. So, Anne, I'm going to feel your uterus, and I'm going to put one hand down here, and you can do this at home. And just hold that uterus so it doesn't. You can do this at home. You can put your one hand down here and feel that hard spot above or right around your belly button. And you want to just press firm and just massage that area, and that will help stop the bleeding. How are your bowels? Have you had any bowel movements since then? Probably not, because it's going to take a couple days, I know. Have they given you any suppositories, any stool softeners? and I'm going to tell her about the Tux pads for the hemorrhoids. Those are really good. Take stool softeners and drink her fluid, a lot of fluid to prevent any more constipation than she may already have. And then I'm going to ask if when I was doing that, if she felt anything weird, pain, anything abnormal other than just the newness of the uterus and the fundus being like that. So I'm going to cover her back up. And then, of course, she probably is in the delivery room, so she's going to have an IV. I'm going to check her patency on her IV. There's no redness, swelling. Doesn't look like it's infiltrated. If she has a fluid bolus going or a fluid going, making sure that it's running correctly and it's not backed up. And everything looks dry and intact on that. And then I'm going, as I'm checking her upper extremities, I am making sure that there's no edema, any more edema than what she may already have. So I'm going to, or top to the belly button. And then I'm going to uncover one leg and make sure that, check for any swelling or edema there. I'm going to check her pedal pulses, and then I'm going to check her pedal pulse, or her pulses on her arms, and making sure that those are regular. Check for edema, like I said. Ask her if there's any cramping, any heat, swelling. I'm going to educate for her on the possibles of DVTs, like get up, get going, get walking, making sure you're going to prevent some of those blood clots that she may have in her lower extremities. And everything looks good. There's no swelling. She denies any calf pain. She looks like she's moving everything correctly. Then I'm going to go and cover her up and do the same thing on this leg. Check her pedal pulses. I'm going to look for redness, swelling, increased calf pain. Does she, like leg aches, anything like that, spasms? And then I'm, like I said, teach her for DVTs and what that means. If they break loose, it can go to her lungs, and watch out for the signs of that, like shortness of breath, chest pain, fatigue maybe. So then I had forgot to mention that before I check her uterus and her fundus, that I'm laying her flat on the bed and I'm explaining that to her. That I should have already had her flat when I was checking that. So as I have her flat, I'm going to check her pad, and I'm going to ask her when the last time that she changed her pad within an hour, and how does that look. I have gloves on, and I'm checking maybe if she had an episiotomy. I'm checking that on the top area before I roll her over to see her back. I'm going to ask if she's gotten up and changed that pad, how long ago. If it's an hour, then you can, I think you said in the video, an hour, and then you kind of measure it on the blood. But if she hasn't changed it in two hours, then you cut that blood on the pad in half. And have you gotten up to go to the bathroom? And then if she says yes, I'm going to check her urinary, I'm just assuming she don't have a catheter in because she had a normal delivery. And I'm going to ask her, any pain, burning, foul odor, anything abnormal of her urine to maybe indicate that there's an infection. And her fever was normal. So I'm just assuming that her pad is normal. She changed it like 20 minutes ago, and there's minimal bleeding. Her urine, she went to the bathroom, she voided. We strained her, or we measured her urine, and that was like 250. So I'm going to make sure I chart all that. And then I'm going, I did her episiotomy. I checked her episiotomy. I checked how much pad of bleeding on her pad. I asked about her urinary, and I'm going to have her roll over. So roll over to, I'm going to verbalize it because she's heavy. So at this point, I'm looking at her back. I'm looking for any redness, swelling, anything abnormal, hot. Let's say she's had an epidural. So I'm going to look at that site, and that's more up in the thoracic area. I'm going to make sure that if they put a bandage on it, or a pressure dressing that's dry and intact and no bleeding through. I'm gonna also check for like maybe her hemorrhoids, and I'm gonna say, Ann, I'm gonna check your bottom area. I'm gonna make sure that, I don't see anything abnormal. Do you have a history of hemorrhoids? I'm gonna ask her that. And then again, I'm gonna teach her about the Tux pads and the mesh panties to go home with, and the ice cooling packs, the importance of fluid, and stool softeners. So as I have her on her back, I check for her hemorrhoids. I'm looking for anything abnormal. I'm gonna roll her over. Let's just say that she's had a C-section. I'm going to look at her C-section scar or her dressing. You said in the video that she's gonna probably still have that pressure dressing on, or the bandage abdominal pad on. And I'm gonna make sure that that's dry and intact, and let her know that that will stay on until the first shower. I her back and all her areas of her wounds, I guess. I'm going to lift her back up into the comfort position. And I'm going to make sure her pad on the bed is clean. She has a clean gown. She has her blankets, everything that she feels comfortable in. And then, Ann, I am through with my assessment. Can you rate your pain? Do you have any pain? And then if she says any pain, I'm going to tell her 1 to 10, 10 being the worst pain that she's felt. So let's just say that she's at 5. I'm going to see if she's due for her ibuprofen or aspirin or whatever the physician ordered for her. I'm going to ask her, I'm going to make sure that her water jug is full, her call light is in reach. I'm going to ask her how she feels, like I've stated before while doing her vitals. I'm going to ask her how she feels emotionally. Is she happy? Does she have a good support system going home? If I can give her any outreach support, I would go and find the pamphlets on that. And I think I'm done.